Please come. So, Dr. Manpreet KOUR will be presenting correlation of impression cytology with histopathology in ocular surface squamous neoplasia.
Yeah. Please remember each free paper is for 5 minutes duration.
And since we will be marking, so please stick to the time.
Is the next speaker Dr. Ipsita Burman here? Dr. Shruti MK. Okay, so just to let you know, you're next, so you can be ready on the other side.
Good morning, everyone. The topic for today's presentation is correlation of impression cytology with histopathology in ocular surface squamous neoplasia. Introduction. So, this is not working. Introduction. The term ocular surface neoplasia was coined by Lee and Hurst. It describes a spectrum of conjunctival and corneal epithelial neoplasia manifesting as dysplasia, carcinoma in situ, and squamous cell carcinoma. Early manifestations are small masses at or around the limbus mimicking pterygium occurring in middle-aged patients. The two major risk factors are ultraviolet B light and human papillomavirus are seen to be responsible. A number of studies have been successful in detecting HPV type 16 and 18 in ocular surface squamous neoplasia. Other reported risk factors include exposure to petroleum products, heavy cigarette smoking, chemicals like trifluoridine, arsenals, beryllium, ocular surface injury, vitamin A deficiency, light pigmentation of hair and eye, and defective DNA repair in xeroderma pigmentosum. Familial origin is also seen. Infection with HIV and other immunocompromised states. OSSN is a slow-growing tumor of low-grade malignancy, which rarely metastasizes. Ocular surface squamous neoplasia can be classified as pre-invasive and invasive squamous cell carcinoma. Ocular surface squamous neoplasia can be diagnosed by certain non-invasive techniques as well as invasive histopathological examination. One of such non-invasive technique is impression cytology, which refers to the histological study of the superficial layers of the ocular surface epithelium. The aim of the study is to assess the accuracy of the impression cytology in the diagnosis of ocular surface squamous neoplasia using the cellulose acetate paper by correlating with histopathology. The study, it was prospective observation and intervention study conducted at Tertiary Care Hospital in Jammu. The study was conducted from June 2017 to December 2018. 42 eyes were included of 41 patients presenting with the conjunctival mass at the limbus or at or over the conjunctiva. Hospital ethical committee approval was obtained. Inclusion criteria, it included all the patients who have the clinical suspicion of OSSN who presented to the Department of Ophthalmology during this period. Patients were explained about the impression cytology and the consent was taken. Patients with extensive involvement, patients with exclusive corneal involvement, and the patient having recurrence and the patient who refused for surgery are excluded from the study. Detailed history was taken from all the patients, best corrected visual acuity recorded, slit lamp and fundus examination was performed, intraocular pressure was measured by applanation tonometry, gonioscopy was performed, all the patients were subjected to impression cytology. In this technique, we use 4% xylocaine was instilled into the eye of the patient. After that, cellulose acetate filter paper was used and it was pressed firmly against the lesion for about 5 to 10 seconds after instilling 4% xylocaine drops. The smear was made on the glass slide using filter paper. The slide was fixed with 100% isopropyl alcohol for half an hour. After staining with H and E stain, slides were studied under light microscope. Studies were observed for the presence of dysplastic cells, inflammatory cells, hyperkeratosis, and other associated findings. Surgery. The tumor resection was performed under local peribulbar anesthesia using 1:1 mixture of 2% lignocaine and 0.75% bupivacaine. Phenylephrine 2.5% drops to include vasoconstriction. After outlining the borders of the tumor, 4 mm margin are marked with the help of calipers at the scleral edges. The conjunctiva is lifted with forceps and the first incision was made with a pair of Westcott scissors. Initial tumor dissection is localized to the marked margin. After completion of the dissection of the peripheral marked margin, the dissection was directed towards the center of the tumor. In the event of tumor adherence to the sclera, a partial thickness sclerotomy is performed with the blade or forceps. Amniotic membrane grafting was done for better healing. Once the lesion is removed, en bloc technique is used. The specimen was marked, sent to pathology in the formalin. Cytology and histopathology reports were compared. Correlation between cytology and histopathology were said to be present if the dysplastic cells were present on cytology in a patient found to have neoplasia on the histopathology. Present study results, 41 patients were included in the study. Out of 41 patients, 24 patients were males and remaining were females. 17 patients found to be above 60 years of the age as depicted in the table. Initial site of appearance was bulbar conjunctiva in 95.5% of the patients. Cytology and histopathology reports were compared. The presence of dysplastic cells in impression cytology and neoplasia in histopathology was considered as a correlation. 3 patients, 7.31% had squamous cell carcinoma. According to morphology, clinical gelatinous type constitute about 60%, leukoplakic in 13%, papilliform in 9%, and pigmentary in 16%. One patient has a bilateral presentation. Correlation between impression cytology and histopathology seen in 36 eyes. No correlation seen in 7 eyes. 85.7% patients have correlation, showing in the table. Discussion. 41 patients were included in the study. Commonest age group of presentation is 60 to 70 years with male preponderance. Most of the patients were farmers and laborers involved in the outdoor activity.
Please be brief, your time is up.
Okay,
Marks will be deducted for
the
crossing
higher
time.
correlation rate in our studies is because of the presentation of the patient in the more advanced disease. In our study, we found that the impression cytology had a poor correlation in the patients having hyperkeratosis. This could be due to the scanty of the cellular yield on cytology in patients with hyperkeratosis. Conclusion of the study is impression cytology is simple, non-invasive technique with a high correlation rate in the diagnosis of the ocular surface squamous neoplasia. But the presence of hyperkeratosis on cytology has a poor correlation with histopathology. These are my references. Thank you.
Did you group your patients according to the severity of the tumor also? Did you find any difference in the correlation depending on the extent of the tumor? So in the small tumors, was the correlation as good as in the extensive tumors?
Yes, ma'am. We found a good correlation, whether it is small. We take all the patients coming in the IOPD. We take every patient who are having the growth over the limbus, at the limbus or over the limbus. Then all the patients found to be good. We found that a good correlation.
I have no questions.
Thank you.